If we can really understand what's going on and how to change it in the most effective way, I think it affords us an opportunity to really have this crystal ball into a person's health and to be able to guide them to a series of interventions that can make profound changes in their health.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Leo Grady, founder and CEO of Jona. In this episode, we discuss Jona's AI-powered microbiome platform. Leo explains how the company analyzes over 200,000 clinical studies to create a digital twin of your gut. Then it recommends research-backed interventions. Plus, he explains why microbiome testing could surpass blood panels as the most important biomarker. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive, preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Leo. Welcome to Fitt Insider. Thanks for joining us.
Thanks so much, Joe. Happy to be here.
Yeah, excited to chat today about Jona Health and all the things that you're doing as it relates to microbiome and really bringing this layer of personalization into health in so many different ways. To kick off the conversation, why don't you just introduce yourself, tell us about how Jona got started, and then we'll get into the details.
Yeah, happy to. So, me personally, I did my PhD in AI over 20 years ago in computer vision. I've been working in healthcare the whole time. So, I started off building AI for radiology, and then I was building AI for cardiovascular diagnostic testing. And then I was leading a company called Page AI that was a spin out of Memorial Sloan Kettering, building AI for cancer detection, where we had the first FDA approval in that space. After that, I worked on the VC side for a bit, helping Jim Breyer invest in AI companies in healthcare. And then about 3 years ago, I started Jona. And I started Jona because I became incredibly excited about the gut microbiome. Every aspect of our health has been linked with the gut microbiome. So it's not just gut issues, it's obesity, it's food allergies, it's skin health, it's chronic fatigue syndrome, asthma, even mental health, depression, anxiety, Parkinson's disease, even cancer. All of it's been linked with the gut microbiome. And in addition, you can change your gut microbiome. So if we can really understand what's going on and how to change it in the most effective way, I think it affords us an opportunity to really have this crystal ball into a person's health and to be able to guide them to a series of interventions that can make profound changes in their health.
Hearing you as you're explaining your background, you're the AI healthcare guy. You're the AI health insights guy. And 20 years ago, long before it was in the zeitgeist and people, it seems like everybody trying to, in some ways, shoehorn this is AI powered, this is AI insights, this is how we're leveraging AI, and really building from a place of that being the kind of central focal point, enabling the different companies that you've worked on, and now obviously Jona. At that time, 20 years ago, and then now building to this point, why was that? Did you envision it being kind of playing out the way that it has with the implications? Did you think, hey, we could continue to leverage this technology in different aspects of health, especially as it relates to like predictive, personalized health, and threading that needle of like focusing on something however many decades ago versus that still being relevant today? That's no small achievement. So do you have a concept of like how and why that worked, and maybe how you've been able to evolve that over time?
I started in vision. That was my PhD. It was in computer vision, really having computers analyze complex images, find tumors, find babies, find hearts, et cetera, and make measurements of all of these things. And computer vision really matured the fastest of all aspects of AI. There's a real inflection point in 2012 with this ImageNet challenge and AlexNet. We don't really think about it, but when you unlock your phone with your face, this is a huge achievement. That blew me away the first time I saw it. I mean, there used to be entire conferences on face recognition where people would fly to Chicago or whatever, and hundreds of people would get there and work on face recognition together. and now it's just in your pocket and it works after just like a few snaps. So in healthcare, I saw that need really early working at Siemens because we were building MRIs, CTs, ultrasounds, every type of imaging equipment. And it was incredibly difficult to extract this information in a way that was robust and that was accurate. But one of the things I learned is that the technology was actually ahead of many other aspects. So we were able, with enough work, to build really clinical grade AI technology. But what I learned is that if you didn't have the right UI, you didn't have the right UX, you didn't fit it into the patient journey or the doctor's workflow, and it didn't talk to the other data systems, and you really were solving the right problem, if you didn't have all of these things, you were not going to build anything that was going to make serious impact in healthcare. And, for a long time, there were regulatory uncertainties, there were payment uncertainties. But, at Siemens, my first FDA approval for an AI system was probably 2006 for doing radiation therapy planning, automated. And at HeartFlow, the cardiology company I worked at, that was the first Medicare payment for an AI product in healthcare, which was about 2018. So over time, we really solved a lot of these regulatory issues. The FDA has been a great partner. We solved a lot of the reimbursement issues as well, although those are still remaining. But the key, I think, to bringing AI to maximum impact is finding the problem where AI in its cutting edge form is exactly the solution that a doctor needs, that a person needs in order to unlock, the next stage of healthcare.
You set this up kind of perfectly in the introduction that, hey, when we're talking about something that has implications across basically every aspect of health, being able to take and apply AI to this and really get to some of those answers around what is it impacting? How is it personally doing that for you? Was that a kind of natural, obvious, like, oh, this is the wedge and this is where we want to apply this technology and it fits like you described into this, you know, patient journey and it's very clear how it can have that impact? And how did you reach that point where it's like you were able to marry these things versus, maybe applying it to lots of different problems or opportunities?
Well, it was two things. One is I was seeing that the most exciting areas of medicine were omics, genomics, proteomics, transcriptomics. But when you look at this data, no human being can look at, thousands and thousands of proteins and really have any understanding of what's going on with somebody. And the only way to really make sense of all that data is to be able to pull information from the scientific and clinical literature to operationalize that information and interpret it. And I saw at the same time large language models were emerging such that we could start to really at scale, at a clinical grade, extract information and operationalize it in terms of interpretation. And I felt like the microbiome was the perfect, most valuable marriage of these two areas because it does impact so much of our health, because we can change it, and because the data is more complex than some of the data that you get out of these other omics. And just to give you a sense of that, like you and I, Joe, we share probably 99.5% of our genes, but our microbiome, we probably only share about 10%. So there are more than 11,000 organisms that have been identified and linked to health. But you and I only have maybe 200, 300 of those organisms, and we have different ones. And then in addition, the medical literature on the microbiome is exploding. We have more than 2,000 studies being published every single month on the microbiome. So there's no way any human being can look at this data. There's no way any human being could read all of those studies. And this is why I felt this was the perfect application for AI technology that could really pull together all of that literature, use it to analyze this data, and then go the next step of telling you what to do about it.
This idea of the research just kind of exploding. I've talked on the podcast a couple times with the co-founder of Lifeforce, which is a longevity platform, and he talks about there's basically a 17-year gap between discoveries in it's kind of like the cutting edge of medicine versus that actually making its way into the clinic. And then when you're talking about the research around the microbiome exploding in such a way, it's like it potentially would never make its way into any type of care plan or implementation or true action on the other side of that. So applying it, right? That's the whole thing, is like, how do we get this to a place where we can act on it? What does that kind of platform and experience look like, maybe end to end, and how is the individual experiencing it, and then how is it like actually working, doing the things that we're talking about?
So the core technology that we built's got a couple pieces to it. The first is that we built an AI system to read all of the microbiome literature. So more than 220,000 studies in PubMed. And then what we're doing with each of those studies is extracting key information. This was a study with 500 people. Half of them had Parkinson's disease, half of them didn't. There were these statistical differences in their microbiome. This was a study on adults, predominantly female, whatever it is, right? So the AI is extracting that information from every single study, and it has to do so correctly. And we had to build a quality management system in place to make sure the AI was extracting that information. Then what we do is we give you a microbiome test. So it's a stool sample. You send it to the lab. We do deep shotgun metagenomic sequencing, and we identify every organism that's living in your gut down to a strain level. Then the AI basically goes study by study over all these 200,000 studies and matches the patterns in your personal microbiome to every study that's ever been published. And so we can say, for you, you have a signature for everything from bloating and constipation all the way to Crohn's disease or Alzheimer's or even cancer. And then the AI tells you which organisms it is, cites all of the studies, and tells you how it works. But then we go a step further, and the AI reads all of the interventional literature on how you can change your microbiome with diet, lifestyle, and supplements. And we know, for example, that going vegan shifts your microbiome in a certain way. And so, what we can do is we can take that shift and apply it digitally to your current microbiome and make like a virtual vegan you. And then we can do the same thing with keto, and we can do it with gluten free. And digitally, virtually, we can give you every dietary change, every lifestyle change, every supplement, and see which of these, there are more than 4,500 interventions that have been studied. Just the AI just steps through each one of them and says, hey, these are the things that you can do that are going to address the gaps in your microbiome. This one's going to have the highest impact, then this one, then this one, then this one, so that you really know what you can do to act upon any problems that you're seeing in your microbiome.
This idea of, to some extent, doing whatever the data capture is, like taking those inputs, in this case, a stool sample, and then having some level of AI intervention engagement on the other side. Obviously, this is unique in terms of just the depth of the research that it's able to then synthesize and then apply. There's maybe sometimes a care team on the other side. There's a doctor. There's a chat. You're able to chat back and forth. There's products, right? A supplement, a particular protein bar, whatever that, a powder, whatever it might be. What happens, I guess, on the other side when we're talking about applying these things? You have your digital twin, you have the different interventions you can apply. What did you choose to kind of provide on the other side? And maybe what did you choose not to provide and why?
I'm glad you asked that question. We made a decision early on not to sell any supplements, not to sell any food, not to sell any additional products. And we made that decision for two reasons. First of all, we wanted to make sure that we never gave anyone the appearance of being biased, of, trying to push them to upsell some other product. And the second is that we work with a lot of doctors. And when doctors see you pushing supplements or food, they get very uncomfortable, and it makes them not trust the results as much. And so for us, we really felt that our credibility, that the trust, that we just wanted to be super squeaky clean on any concern about bias or incompleteness. And so that's why we made the decision not to sell any additional supplements or any additional food. However, for example, with probiotics, we will tell you find a probiotic that contains this strain, and that strain, and avoid a probiotic that contains, this strain and that strain. But we just won't tell you what company to buy from.
You mentioned there that, working with clinicians, doctors, there's obviously the kind of consumer patient angle, there's getting integrated into practices, concierge clinics. Now this obviously an entire world of longevity, both digital and in person. Who's using it? Like, how are you partnering? What is that, if you think about who's the customer, and then how are you engaging these different groups? Because I'm sure there's a lot of interest in applications and all those different settings.
So you're right. We do two things. One is we sell direct to consumer, and we partner with some companies that are offering similar services that want to offer Jonah to their customers as well. So we are reaching a lot of consumers either through partners or through direct, advertising and influencers and all of those things. In addition, you're right. Longevity, functional medicine, concierge medicine, dietitians, but even conventional GI docs now. And our first academic medical center is starting to use Jonah clinically. So we're seeing a wide range of different clinicians wanting to use Jonah. And we also see a real fusing between the longevity world and the functional medicine world to be able to provide not only chronic disease management and root cause analysis, but then also to help people with prevention and to, ultimately take their health to the next level.
When it comes to the like digital twin, it's I think now even trailing like AI has kind of like this emergence and explosion, right? Of course, led by ChatGPT and like just how we engage with it and what that means. There's some kind of, especially in more medical terms, and then some kind of select companies that are advancing and really pushing like digital twin. And this is what it means, and this is how you use it. I don't know, and maybe you have a perspective on this, that it's kind of as known or as well articulated as maybe just like when we're talking about some of the things, other things we've talked about in the conversation. For the purposes at Jonah, like what does that digital twin actually entail? How did, it's like, does the consumer patient engage with it? And is it a situation where, they do this stool test, you're able to do the analysis, and that's basically it? Or is this like a recurring testing feedback loop situation where maybe even that digital profile will evolve if they choose to implement the different interventions that you're recommending?
The history of digital twins in medicine is really super interesting. And I had the good fortune when I was at HeartFlow, this cardiology company, where we built a virtual stenting application. So not only we measure and assess somebody has coronary disease, but maybe they would have coronary disease in three places. Do they need three stents? Do they need one stent? It wasn't necessarily obvious. And so we built a tool that would allow them to put in virtual stents and see how it would restore blood flow and be able to calculate that and validate that. And that technology, really was a digital twin for cardiovascular disease. And that got approved by the FDA in 2019 and is available today for PCI, stent planning. That technology, working on that with really one of the pioneers in the space, the founder of the company, taught me a lot about how to think about digital twins. And you're always making a model, right? So it's always some impoverished version of reality. And you're never making a model of the entire physics of the person, of every single system. So with us, with the digital twin that we built at Jona, it's really the gut microbiome. And we take your gut microbiome and we try these different interventions virtually, and we shift the organisms digitally that we found in your test results and say, okay, well, if these species go up, those species go down, how's it going to impact your health? If we found this issue, if we found fatigue in your microbiome, is it going to make it better? Is it going to make it worse? And so, with all of that machinery that we built, it allows us to really hone in on the few things that are going to have the biggest impact for somebody. Now, you also asked about, frequency of testing, how often people should do that. It depends on why you're getting tested in the first place. There are basically three groups of people who are getting Jonah. So we have one group of people who have health issues. They're looking for root causes, they're looking for solutions, and they come to Jonah to see if there are answers in their microbiome. Then there's a second group of athletes, biohackers, the med spa world, people who want to perform better, who want to look better, who want to feel better. And then there's a third group of general wellness. They want to do a checkup. They want to make sure that everything's okay. They want to get ahead of it if there's an issue, but they're not really looking to change anything. So that last group, maybe they would come back once a year, and just like blood work, they would make sure everything's okay. But those first two groups, the people who have a health issue or the athletes and biohackers, they really want to actively change their health, and they want to know that the changes they're making are working, and then make adjustments as they see those changes in action. So for them, what we see is that they come back every 3 to 6 months and retest.
This episode of the Fitt Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, EGYM's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, EGYM equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of EGYM's ecosystem at egym.com. You mentioned there like med spas, biohackers, athletes, that kind of fits along the lines of what I mentioned earlier about longevity clinics and things like that. Obviously, we're having this kind of explosion of, just any number of companies that are either kind of solely existing to give you a blood panel at, $400 or $500, or
Right.
bolting on the ability to give you the kind of labs, A to Z. Is a microbiome test like, should that, or do you foresee a future where that just like sits right along when you're talking about this preventative care kind of like toolkit? That's one of the things you could have. If somebody has a wearable, pick your wearable of choice. Somebody gets their blood tests, somebody gets XYZ scan. Also, there's a microbiome test that in theory you should be doing if you're taking these things seriously.
I'd actually go a step further and say that I think microbiome testing will actually be bigger than blood testing in the future. And the reason I say that is because the microbiome is the ultimate biomarker. There's so much information in your gut that is related to every aspect of your health. And even when you do one of these blood panels, it's 200 markers. I mean, we're seeing hundreds and hundreds of different species. We're seeing their genetics. We know what metabolic pathways they're upregulating or downregulating in your body. We know how much antimicrobial resistance you have. We know how many of your human cells you're shedding into your gut. We get so much information that goes way beyond any blood panel. And so I honestly believe that microbiome testing is going to supplant and be more important than blood work in the future. But to your point, in the coming years, I do see microbiome testing sitting right beside blood work and some of these other panels that people do frequently.
Is that just a an awareness problem? Was it a technology problem not being able to apply it? Was it like what's kind of gotten us to this point where there's, there might be a list of 10, 15 other things that people would do or gravitate towards before they get to a microbiome test if they ever did it.
Yeah, I think for a while it's been a technology problem, right? I mean, the great thing about a blood test is you say your hematocrit is this. What is the normal range? Your HCl is this. What's the normal range? Are you in range? A microbiome test, you'll say like, well, you have this much Akkermansia, and you'll have this much E. coli, and you'll have that much. Oh, well, yeah, you can look at normal ranges, but what we know is that if you want to know that your microbiome looks like diabetes or obesity or Parkinson's or fatigue or chronic fatigue, it's this consortium of organisms being high or low. And so you really need to look at more than a single marker in order to understand what's going on in your microbiome. And I don't think until Jonah came along and built the technology that can really digest all of this literature and put it together in a way that is operationalized, actionable, that can not only do these assessments, but then cite back to the source literature and the source evidence, that now it opens the door for us to be able to analyze this data and really extract way more information from it than was possible just a year or two before Jonah really nailed this technology. And then of course there's like the education piece to it too.
Do you look at it and say, hey, it's incumbent upon Jonah to do this education in terms of what the testing is and how we apply it and really kind of build this category, build this service? Or do you, and probably maybe a combination of both, that naturally over time it'll kind of, as people continue to go down this, pipeline of preventative health and different tools and diagnostics, that it inevitably like reaches this place where the awareness intersects with, where the technology is?
I think it's a combination. I do think it's incumbent on us to drive awareness and drive education, because we are the ones who built the technology and we are the ones that are making this available. We try to do it through multiple channels, right? So talking with you today is an opportunity to educate your audience on what's possible and what can be done. We do webinars with doctors. I'm going to Denver in a couple of weeks to teach a class for a bunch of longevity doctors where we'll be talking about the gut microbiome. Our chief medical officer is out there giving a lot of talks. And then we're partnering with, the Institute for Functional Medicine or Functional Medicine Coaching Academy to put on seminars and to put on educational materials that can really try to reach an audience of clinicians as well. But then we have a blog, we have a newsletter. We try to put out content that is really unique, that only us can put out, and is also really interesting and informative to people.
Early, I guess, coming into this conversation, and like as I was preparing for it, and then hearing you describe the technology initially, like on one hand, it was, I had the thought, is it, hey, if we could do this for the microbiome, then we could really do it for, you name it, any other application, any other biomarkers, any other prevention focused area of health. And maybe that's the case. You can tell me. But then on the other hand, in this part of the conversation, it's kind of seems more like, no, why would we need to do that if we could just double down and essentially make microbiome testing exponentially larger than it is now? And to your point, even maybe supplant blood testing in a way that like this is the definitive biomarker and we just have to bring that future like into reality.
Yeah, I think the microbiome is the ultimate biomarker, and it's extraordinarily data rich about your health. If we think about building Jonah's technology and applying it to a big blood panel, I don't think it adds as much value, right? Because there's just, a doctor doesn't need to know how to read a lipid panel or a metabolic panel or anything like that. It's pretty simple, honestly. And so, yes, there are some insights that you gather by, extracting lots and lots of these biomarkers and trying to put them together in a story. But the value add is just not nearly the same as with the microbiome, where you have no hope to try to understand this information. There's no way you're going to read 2,000 studies a month. There's no way you're going to be able to remember them and apply all of them to analyze this very complex data. And that's why I feel like the technology is the key unlock that allows us to start using this ultimate biomarker practically and to build real immediate interventions on things that you can do about it. So yeah, to your point, I think blood markers and all could benefit from technology like we built at Jonah. I just think that the value that gets created from doing it is going to be much less than what we do with the microbiome. I think with the microbiome, it's absolutely essential that we have this technology.
With the technology being such a focal point, and really then being able to apply it in a way where like you can meaningfully impact, like you said, we can shift the microbiome and pretty drastically. Is it, when you look at all the other different interventions, whether that's wearables, whether we talk about blood panel, whether we talk about, we can get caught up in tracking any number of things about our health. Is it more or less that, we're kind of driving ourselves crazy and like maybe not moving the biggest, most impactful areas, like almost kind of have it backwards in terms of, yes, your whatever metric, your kind of sleep score, recovery score, XYZ is good. That's important. Maybe it's helpful if you're trying to move one particular behavior along and have an awareness about those things. But really, if we're serious about overall health and specific outcomes, like there are needle movers that like we're not even scratching the surface of at this point, and certainly not for like a general population, let alone like athlete biohacker, kind of like longevity seeker.
Yeah, I do think that's accurate. I have an Aura Ring, I have a Whoop, I have an Apple Watch. I really value those insights, the sleep tracking and everything that they offer. But are those markers going to tell you that you look like you've got ulcerative colitis, or are they going to tell you that you look like you have back pain or sleep apnea? I mean, it's insane the number of aspects of your health that are linked with the gut microbiome. And so I do, to your point, I think that this is an area that people are just not aware of and that has this really profound impact on people's health. But because they're not aware of it, because they're less educated about it, because they're not aware of some of the technology, they're not necessarily taking advantage of what's out there in order to better understand their health and optimize it.
Pulling this thread a little bit more around just the awareness and, I think in some cases, excitement around preventative health tools, diagnostics, wearables. Obviously, this is a subset of the general population who, on the whole, is not healthy, is not as healthy as we'd all kind of hope that we would be collectively. But when you do think about, and this is how I like to think about it, right? That the taking the optimistic approach, which is all of these things are moving us towards a future where we have more information, we have more actionable insights, we can affect change in a way that leads us to improve health outcomes. Is it just in the near term that we have all these different siloed tests and diagnostics and digital twins? Like we have multiple digital twins of ourselves across different platforms and biomarkers. And somehow we've talked about this quite a bit, both on the podcast and in the newsletter, like building a dashboard that then puts everything into one operating system. But just thinking about how we navigate that and get it to a place where we can like synthesize all that information and move maybe in the right direction. Yeah, do you just have a perspective or even opinion on how that evolves in a way where it's not just fractured and siloed maybe?
As you point out today, you get your microbiome test here, you get your blood panel here, you have your Aura Ring there. All of that data lives in different spaces. And there are companies that will, accept different data streams and try to pool them all in one place. But you're not really gaining anything from that, except that maybe it's all in one place. when you start talking about putting together two different digital twins or interpreting the data across the microbiome and the blood work or in the genetics, that becomes very complicated, like very technically complex to do that right. And so I think that we will see some of those silos come together into like a single dashboard, into a single warehouse. But to be able to actually merge them into something that's greater than the sum of the parts, I think it's going to take a lot longer and going to require some innovation, not only technically, but on the business model that's going to make that effective.
It's still TBD. I think there's a lot of, like you said, a lot that has to happen that enables that and actually makes it something that there is actionable recommendations on the other side of all that. One other thing was, a lot of times when we hear whether it's a wearable, diagnostic, continuous monitor of some kind, there's a benefit or at least a claim that we have X amount of CGM data, we have X amount of hours of activity data or hormone data. When it comes to the microbiome and the kind of assessment that you're doing, is there this accretive, now we have this microbiome abundance of data, we can study that in addition to the PubMed studies that you're kind of cross referencing and doing this? What role does that kind of like stool actual diagnostic data play in the platform?
Yeah, the core technology was built off of PubMed. Like I said, 220,000 studies that the AI read, ingested, quality controlled, operationalized in order to analyze your gut microbiome and then also tell you with the digital twin what to do about it. As we get real world data from customers, from doctors, that can help us inform new features, and it can also help us gut check what has been observed in the literature. To take the step of taking proprietary data and starting to build new associations with it or to incorporate it into the literature starts to make us look more like a diagnostic device. And I think the FDA at that point could very rightly say, hey, you're using this black box data and you're telling somebody they've got a higher risk of Parkinson's disease. You need to go prove that. Whereas today, we're saying, based on these 70 studies on Parkinson's disease, you fit the profile or you don't. So, from a regulatory standpoint, using proprietary data is something you have to do carefully. But it is something that we can use internally for a lot of quality control. And then as we think about actually building in the future true diagnostics where we can say, hey, we can detect Parkinson's disease 5 years before you start to see symptoms, that kind of data is going to be really invaluable for us to build those true diagnostics in the future.
And then just building on that as you look out into the future, whether it's the rest of this year, the upcoming months. I know in the early stage company, months or years, like everything kind of runs together. So you don't want to get too far out in terms of forecasting or projecting, but just what's top of mind, new features, partnerships, clinical research. Like, is there anything that we should look out for that you're particularly excited about as you're talking to the team and continuing to build?
Yeah, we have a really exciting roadmap for the rest of this year. Even though the AI has read everything in the literature, we don't necessarily include it in the product today for a variety of reasons. So we're going to be adding whole new categories of analysis. Today we look at how your microbiome is impacting brain health, metabolic health, GI health, skin health, and physical performance. But there's several new categories that we're going to be adding this year and also adding dashboarding that allows you to track over time all of your results and really see how things are changing from time point to time point. We absolutely intend to build true diagnostics. There are a range of diseases that seem to be detectable in the microbiome before they show up in, symptomatically. So there's Parkinson's disease, there's pancreatic cancer, there's colon cancer, there's fatty liver disease, a whole range of different diseases that we believe that we can detect early and, ultimately build a diagnostic and a screening tool for this set of diseases.
Yeah, super exciting and impactful as that continues to take shape. For folks that are interested in learning more, whether that's getting a test or just following along with everything that Jonah's doing, where would you point them?
So they can go to our website, Jona.health, and you can order tests there. I'd also encourage them to sign up for our newsletter, our blog, and follow us on all the socials: Instagram, Facebook, and LinkedIn.
Perfect. We will make sure everything is linked up, easy to find in the show notes, and really excited to share this conversation. Appreciate you spending some time with us today.
Thank you so much, Joe. This is really fun.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.